Hi, everyone. My name is Audrey, and welcome to discussion number 4. In this discussion, we'll be talking about the Clark 2022 paper as well as the Frizzetti 2022 paper. All right, so first we'll talk about the Clark 2022 paper. This is titled Cognitive Reappraisal, and this article highlights one of Aaron Beck's most impactful developments in psychotherapy and CBT specifically, that is, cognitive restructuring. Cognitive restructuring is an intervention designed by Beck, which utilizes cognitive reappraisal or reevaluating unhelpful thoughts to alleviate negative emotions as a change mechanism in symptom reduction. The specific steps involved in cognitive restructuring are identifying automatic negative thoughts and acknowledging their connection to negative emotions, evaluating the accuracy of these thoughts, and coming up with alternative, more helpful cognitions. The article also discusses the question of whether cognitive reappraisal is necessary for symptom change in Beck's cognitive therapy. The article concludes by saying that cognitive restructuring is an effective intervention, although research is mixed as to what the mechanism behind its effectiveness is. So I have 2 discussion questions for you regarding this article. Number 1, the interconnectedness of emotions, thoughts, and behaviors can make it challenging to isolate mechanisms of change in the system. For example, Clark notes that even symptom reduction itself can lead to cognitive change, indicating that there is a bidirectional relationship between symptoms and cognitive change. What are some research techniques one might employ to isolate the different variables within the system? Number 2, Clark concludes the article by stating that what is ultimately most important for the majority of clinicians is the fact that cognitive restructuring is an effective treatment regardless of its mechanism for change. While this is true, what is the importance of conducting research on and identifying mechanisms of change? All right, and now we'll move on to the second article by Frizzetti. And this article was published in 2022 and is titled Dialectical Thinking. So, this article describes dialectical thinking, the distressing thought patterns that it can help reduce, and provides some examples. Dialectical thinking is a set of strategies to reduce automatic negative thoughts, dichotomous thinking, polarizing and concomitant negative emotions, emotion dysregulation, and impulsive and other problematic behaviors. It purports that judgments of good and bad are always potentially problematic and are not accepted as a definite reality. Rather, points of view, such as, I felt angry when you did that, are viewed as legitimate. A principal component of dialectical thinking is the idea that any given thought or point of view is only one perspective, and one must consider other views in order to see a fuller and healthier picture. So there are 3 discussion questions for this article. Number 1, some clients may find it difficult to understand or accept the paradox that acceptance of their painful emotions can help them ultimately feel better. Why might a client find this concept challenging? And what might you say to help them be more open to this intervention? Number 2, provide an example of polarized thinking that is common in our society. Consider the different socio-ecological levels, such as interpersonal, organizational, etc. What is a dialectical perspective that may replace this polarized thinking? Number 3, in the conclusion, the author describes the difference between cognitive reappraisal and dialectical thinking, that is, changing the content of our thoughts versus changing our thought processes. Describe how you might determine which of the 2 techniques might be better suited to a given client. Thank you, and I look forward to your discussion posts.